Today's topic is better living through bacteria, probiotics for the gut and beyond. I have no actual or potential conflicts related to the presentation of this program. The role of ingesting living microorganisms or good bacteria found in foods and dietary supplements in the treatment and prevention of various disease states has been theorized for years. In recent years, there have been an increasing number of studies evaluating the beneficial effects of probiotics in numerous health conditions. So in this program, we're going to start out by reviewing what are probiotics, prebiotics, and symbiotics. We'll talk about the postulated effects of probiotics and what conditions are likely to be improved by the use of probiotics based on scientific evidence. We'll then talk about what are the sources of probiotics, including various foods and supplements. We'll finish up by applying the knowledge of probiotics to a patient case to recommend a supplement if appropriate. What are probiotics? They are live microorganisms which, given in adequate amounts, alter the microflora by implantation or colonization in a compartment of the host and confer a health benefit on the host. When this definition mentions compartments, this can include such sites as the oral cavity, the intestines, the vagina, and the skin. Probiotics are also referred to, of course, as good bacteria or helpful bacteria, but they're not always bacteria. The word probiotics comes from Greek and means for life. A prebiotic is a nutrient or non-digestible food ingredient that beneficially promotes the proliferation of probiotics. Prebiotics are typically classified as oligosaccharides, which are compounds consisting of sugar components. Examples of oligosaccharides include inulin, lactulose, lactose sucrose, and fructooligosaccharides. In comparison to probiotics, prebiotics alone have not been studied in depth for their health benefits. There is a little bit of information on combining them with probiotics. A product that combines probiotics and prebiotics, which specifically work together, has been defined as a symbiotic. The use of probiotic supplements has been growing rapidly. Awareness of the term probiotics grew from 9% of people surveyed in 2002 to 60% in 2009. In a 2011 survey, 45% of Americans considered themselves very or somewhat knowledgeable on the subject, compared to 36% in 2009. The category of probiotic supplements has had an 80% annualized growth, with sales of over $144 million in 2011 alone. Before we talk in depth about probiotics, we need to spend a few minutes talking about our normal gut flora. We also have normal flora in many other different body compartments. I'm focusing on the gut because the majority of the research with probiotics is in using ingested forms rather than spreading them on the skin or inserting them into any other body cavity. Our body's normal flora is also known as the 100 trillion friends you didn't necessarily know you had. Our intestines harbor roughly 10 to the 14th microorganisms comprising bacteria, fungi, and protozoa. Bacteria represent the majority of the gut flora, accounting for about 60% of the total. This slide lists the major bacteria present in various areas of the GI tract, but over 1,000 different types have been found, and we're also finding that people with certain diseases have certain bacterial flora, which is different from normal gut flora. Although we tend to think of bacteria as harmful germs, in the gut they actually help the body function properly. It's been said that in the body of a healthy adult, cells of microorganisms are estimated to outnumber human cells by a factor of 10 to 1. So why do we have all those bacteria cells in our body, and why are they important? Well, the gut microflora has multiple functions, as represented on this next slide. These functions can be divided into three broad categories: metabolic, structural and histological, and protective functions. For example, under the metabolic category, certain intestinal microbes are known to produce vitamins, including biotin and B12. Also, microbes in our gut metabolize lactose and some other things. On the structural and histological side, our microflora reinforce the barrier function of the intestinal mucosa, helping it to prevent attachment of pathogenic microorganisms and the entry of allergens. In studies done with microbe-free laboratory animals, evidence is actually strong that without normal microbial populations, the immune system functions poorly, and resistance to pathogenic bacteria is greatly reduced. So that's part of the protective functions of these bacteria. Overall, the intestinal microflora are important for the maturation of the immune system, the development of normal intestinal morphology, so normal intestinal lining, and maintenance of a continued and immunologically balanced inflammatory response. The concept behind health benefits of probiotics was actually introduced in the early 1900s when Nobel laureate Elie Menshikov, known as the father of probiotics, proposed in the Prolongation of Life optimistic studies that ingesting microorganisms can have substantial health benefits for humans. He actually drank fermented milk every day based on the belief lactic acid producing bacteria could prolong life. It's thought that we can develop a dysbiosis of our normal flora, and that is an imbalance in our natural gut flora. Stress, antibiotics, disease, poor diets, and aging can all cause disturbances in our natural flora and may lead to the development of disease or the worsening of disease. The next slide shows some of the many proposed benefits from probiotic consumption. At its simplest, probiotics work by restoring the balance to the intestinal flora. But you'll notice there are many other proposed benefits here. One thing with probiotics that is a current area of research is the effects of dead bacteria in probiotic cultures. We think traditionally that the bacteria or yeast have to be alive to be effective. For some of the indications, this is true, such as, of course, normalizing intestinal flora. But dead bacteria or yeast seem to provoke an immunologic response. So here, think about vaccines where we give dead viruses and our body responds to them. So we'll talk in more detail about some of these uses. The list on this slide is potential uses for probiotics that have been mentioned in the literature and on the internet. I'm going to focus as we go along on those situations where there is the most scientific data supporting probiotic use. You'll see I've divided these here in categories of strong evidence, moderate evidence, not so much evidence, and basically theoretical. It's important to note that the FDA has not approved any dietary supplement-based health claims for probiotics. So the supplements can't list on their label, good for inflammatory bowel disease. But they can list the typical dietary supplement label of supports a healthy immune system or supports a healthy GI tract. The 4 most commonly used probiotic types are listed in the table here. I like to call this the also known as slide. There are many different strains of each type of probiotic, and product labeling may use any of these names, and sometimes manufacturers make up their own names. Bifidobacteria, lactobacillus, and Bacillus coagulans are all bacteria. Saccharomyces is a yeast, and we'll talk more about each of these as we go along. Species from other bacterial genera, such as Streptococcus and Enterococcus, have also been used as probiotics, but there are some concerns surrounding the safety of such probiotics because these genera contain many pathogenic species, particularly the Enterococcus. Bacillus coagulans is another area where there is some concern, and you don't see Bacillus coagulans used quite as often in probiotic products. This is a spore-forming lactic acid-producing gram-positive rod that is not a component of the normal human flora. Natural database gives it a not enough evidence to rate efficacy listing. Many times it's also mislabeled as Lactobacillus sporogenes, even though it is technically not a lactobacillus. Bifidobacteria are normal flora and are also the most studied of the various probiotics. Bifidobacteria appears to be the most important organisms in the intestine for providing a microbial barrier to infection. They actually produce antimicrobial substances that have activity against many gram-positive and gram-negative organisms. Bifidobacteria belong to a group of bacteria called the lactic acid bacteria. Lactobacillus, like bifidobacteria, are normal flora and produce lactic acid. There is some evidence that Lactobacillus GG, a strain of Lactobacillus rhamsus, attaches to intestinal epithelial cells better than Lactobacillus acidophilus, so it might be a better choice. Saccharomyces are not normal flora and are usually non-pathogenic. Rarely, oral use of Saccharomyces has been associated with fungemia in both immunocompromised and immunocompetent patients. Most cases of fungemia have been reported in intensive care units in patients with indwelling catheters or intravenous lines. Someone's giving them a probiotic, usually through an enteral tube, and they're wearing gloves when they're doing this, but the yeast cells can actually stick to plastic and stick to gloves, and the person ends up contaminating the patient's other lines, and the yeast can get into the bloodstream. We'll now move on to talk about some of the indications with the best scientific evidence. Our first indication to talk about is antibiotic-associated diarrhea. The incidence of diarrhea secondary to antibiotic use has been reported to be between 5 and 40% of patients who get antibiotics. But don't you sometimes feel like it's a whole lot higher than that? The mechanism is thought to, of course, be alterations in the normal flora, allowing for pathogenic organisms to overgrow. Various probiotics have been studied for antibiotic-associated diarrhea in adults and children. Lactobacillus rhamsus GG is the most extensively studied. For prevention of diarrhea, probiotics can be taken starting the first day of oral antibiotic treatment and continued for 2 weeks after the completion of antibiotic therapy. And you continue it to make sure you're keeping normal flora well established. For treatment, it's recommended to start taking probiotics as soon as symptoms appear. However, if symptoms persist for several days or the patient has severe diarrhea, bloody stools, or fever, they need to be evaluated. They shouldn't be treating this themselves at home. For supplements, doses of greater than or equal to 5 billion colony-forming units per day appear more effective than smaller doses. For yogurt, 4 to 8 ounces per day has been effective in studies. It may be advisable to take probiotics and antibiotics at least 2 hours apart to allow absorption of the antibiotics and to reduce any possibility that the antibiotic will kill the probiotic organism. Now, this is not an issue for Saccharomyces since antibiotics would not kill it. It's recommended with Saccharomyces-based products to not take them with antifungals. So if somebody's doing an antifungal, they should do a bacteria-based probiotic. If someone has a history of developing diarrhea every time they start on antibiotics, I suggest they do prophylactic probiotics. Probiotics are also effective for treating other forms of diarrhea. One is that due to Clostridium difficile, Saccharomyces, Lactobacillus have both been studied and found to be effective. In a meta-analysis, prophylactic probiotic use decreased the risk of developing C. diff in people who were predisposed to this by 50 to 75%. Products with multiple bacteria were of better benefit, and they were the ones that provided the 75% reduction. Rotavirus is a common cause of diarrhea in kids, especially who attend daycare. Lactobacillus species listed here has been shown to be effective in treating rotavirus. Other forms of diarrhea that probiotics are effective in treating are traveler's diarrhea, and that's secondary to antibiotic treatment for H. pylori. Using probiotics secondary to H. pylori treatment is a special case of antibiotic-associated diarrhea because you are trying to kill the H. pylori while preserving other bacteria. In studies, eradication rates of H. pylori were not affected by probiotics. So probiotics are beneficial in increasing tolerability of these H. pylori eradication regimens. Patients who got probiotics with their regimen had decreased nausea, taste disturbances, and diarrhea compared to placebo. Probiotics may be especially helpful in patients with recurrent H. pylori infection and a history of GI adverse effects with the antibiotics. Irritable bowel syndrome is our next indication for probiotics to talk about. Irritable bowel syndrome is characterized by abdominal pain, bloating, and changes in bowel habit in the absence of any overt mucosal abnormality. So they have all these symptoms, but they don't have ulcers in their colon, they don't have inflammation. Irritable bowel syndrome is associated with abnormal intestinal microflora communities, but their significance in the pathogenesis of this syndrome is unclear. Organisms listed here, along with combination probiotics, in studies have helped patients have reduced symptoms and improve their regularity. Inflammatory bowel disease is another reason patients will many times seek your recommendation for probiotics. Although some of the symptoms are the same, inflammatory bowel disease is different from irritable bowel disease because in inflammatory bowel disease, the intestines are inflamed. This is a disorder of the immune system. Symptoms include abdominal cramps, pain, diarrhea, weight loss, and blood in the stool. It's usually divided into two broad categories, Crohn's disease and ulcerative colitis. In Crohn's disease, ulcers can develop anywhere in the intestines, including both the large and small bowel. In ulcerative colitis, you only see inflammation in the large intestines. Some studies have suggested that probiotics may help decrease inflammation and delay the next bout of disease in people who achieve remission. Ulcerative colitis seems to respond better to probiotics than Crohn's disease, and it may be that that's because Crohn's disease tends to be a worse disease, and actually the inflammation can invade all the way through the intestinal wall. There's a lot of interest in using probiotics in inflammatory bowel disease because there's information coming out that abnormal bacterial colonies in these patients may be part of the mechanism by which they develop an immune defect. But the majority of the studies that seem to show response with probiotics at this point are in ulcerative colitis and really in preventing patients from relapsing once they achieve remission. Functional constipation is when a patient has constipation, but you can't find a reason why. So you could also call it idiopathic constipation. Probiotics have been studied in functional constipation in both adults and kids. It shows that with probiotics you can get improvements in defecation frequency and stool consistency. You can see some of the products, some of the particular bacteria that have specifically been studied in functional constipation. In kids, the data would seem to suggest that a combination of bacteria is more helpful than a single agent in improving kids' functional constipation. We don't know whether that's true in adults or not. Personal experience, and this applies to most of the indications for probiotics, is that people have to try several different bacteria or combinations to find the one that works for them. They also have to do some experimenting to find the right dose that, in the case of constipation, makes them regular but not too regular, because you can give people diarrhea. You can put them too far to the other end of the spectrum. Lactose intolerance is an indication many patients might not think of for probiotics. Of course, lactose intolerance is very common, particularly as we age, and it's the inability to digest lactose. So people get gas, diarrhea, and bloating. Probiotics allow good bacteria to establish in the gut, and these bacteria can digest the lactose. Patients may be a little reluctant if you suggest that they use yogurt to treat their lactose intolerance because it is a dairy product, and they tend to avoid those like the plague when they know they have lactose intolerance. The bacteria listed here, which are commonly found in yogurts with active cultures, have all been shown to increase dairy product tolerance in people with lactose intolerance. Treating alterations in vaginal flora are another popular indication for probiotics. Lactobacillus is the major normal vaginal flora. Lots of studies have used probiotic suppositories, vaginal tablets, and oral formulations to both treat and prevent vaginal yeast and bacterial infections. The two most common types of vaginal infections are bacterial vaginosis and Candida or yeast infections. BV is by far the most common. Nearly half of all vaginal infections are classified as bacterial vaginosis, while about 29% are classified as yeast. But it's common for women to mistake one for the other, and they treat what they think is a vaginal yeast infection with an over-the-counter product, but it doesn't clear it up. Now, to distinguish between the two, bacterial vaginosis generally results in an excessive grayish-white discharge and a bothersome fishy odor, which can be worse after sexual intercourse. There may be itching and redness. Yeast infections are very uncomfortable too. Symptoms there generally include itching and burning inside and outside with a white discharge that may look like cottage cheese. When you look at Candida-based infections, yogurt daily has been studied, appears to reduce incidence in women who chronically get these infections. For bacterial vaginosis, prevention studies have found small decreases in incidence of recurrence. It's not hugely effective. Probiotics can be used to treat bacterial vaginosis. One study I found used a combination of metronidazole plus a probiotic was better than metronidazole alone. So most of the studies have combined it with other treatments, with prescription treatments, rather than using probiotics alone for treatment. A couple of products that are marketed specifically for vaginal flora are Refresh Pro B, Florafem, and PureFem. We've talked about what are probiotics and what are some of the best studied indications for them. So now let's move on to talk about specific products. Probiotics are available in varied forms, such as yogurt and other fermented milk foods, capsules, tablets, beverages, and powders. The primary food sources of live bacteria are fermented milk products, such as yogurt, kefir, acidophilus milk, etc. Yogurt, of course, is often suggested as a probiotic source, but the two major bacteria used in the fermentation of milk to yogurt Lactobacillus bulgaricus and Streptococcus thermophilus might not survive transit through the gut to the colon, eliminating their probiotic effects. There are data on both sides of the story. Some data says it survives, some data says it doesn't. So what's the bottom line on yogurt? Yogurt with live active bacteria does seem to work for most of the indications for which it's been studied. Some other less accessible sources of probiotics in food are soy-based products such as miso, tempeh, and soy yogurt. Also sauerkraut and kimchi, both fermented cabbage products. These aren't things that most people eat. Yogurt tends to be the most accessible food source of live bacteria. The two bacteria strains that I mentioned previously used to make yogurt can help lessen the symptoms of lactose intolerance. Of the manufacturers of yogurts are beginning to add other bacteria that have been studied for decreasing inflammation or boosting immune system. The Dannon Company is one example that makes nationally branded yogurts of different varieties. Activia is heavily advertised. It contains Bifidus regularis, which is their patented name for the bacteria, which is Bifidobacterium animalis lactis, and all those little numbers after it. This particular yogurt has been studied for irritable bowel syndrome in improving intestinal transit time and digestive symptoms. In the studies, it was used 3 times a day. I find that most patients don't need a yogurt product 3 times a day. You can usually start with once a day and that will be sufficient. Some people may need to go to 2 servings a day, but I have not honestly encountered anyone who needed 3. Dan Actives is another of their product. It's billed for immune system. It contains Lactobacillus casei, which they call immunitas, so boosting the immune system. Their Danimals product contains Lactobacillus GG, Ramses GG, and this is another one that is good in kids in treating many of the sources of diarrhea. So if you think about how to divide these bacteria up, Lactobacillus species appear to increase immune response, at least in test tubes. Bifidobacteria seems to have a more anti-inflammatory profile. So Lactobacillus for immune system, Bifidobacteria for anti-inflammatory. So if someone has an inflammatory based condition. There's no hard and fast rule on that. There's definitely controversy as to what bacteria and what strain is best for what indication. Stonyfield and Yoplait are 2 other national brands of yogurts. You can see here what the Stonyfield yogurt contains. It's important to note that many times Greek-style yogurt, which is a strained yogurt, does not always contain the same bacteria. You can look on most of the national brands' website and find out what bacteria are in each product. A major issue with yogurt is it's hard to quantify how many colony-forming units are in a particular serving of yogurt. The Yoplait Yo Plus product is an example of a synbiotic. It contains B-lactis, BB12, and inulin fiber, and it actually will tell you how much is in it. It has 1 billion colony-forming units per container. It's been studied in irritable bowel syndrome, where it improves transit time and reduces diarrhea. If patients are not going to use food sources of probiotics and are going to select a supplement, there are some things to think about to pick out a quality probiotic supplement. You need to think about the viability of the organism. How many organisms are alive in the case of active cultures or can come alive from their inactive freeze-dried state when purchased and used. Some products make no claim at all, and others only claim the amount at the time of manufacture, so we'd like for that to be labeled. We would also like probiotics supplements to not have contaminating organisms. The product should contain what it says it contains, while potentially pathogenic microorganisms or other contaminants are not present. Now, I've not seen an issue, at least on testing of probiotic supplements, of there being contaminating organisms. We'd also like the organisms to be protected in the product so that they will survive transit through the stomach. Ideally, a product should contain bacteria that research shows can survive passage through the stomach. Most lactic acid secreting bacteria can survive the acidic environment of the stomach. If it can't survive, it should be enteric coated or have some other protective formulation like microencapsulation. We'd also like products in tablets with or without those enteric coatings to dissolve properly. Like all tablets, we don't want them to pass through whole. In general, most Lactobacillus, Bifidobacterium, and Streptococcus species do not need enteric coating as they can survive passage. Some products do need to be refrigerated or at the very least stored at room temperature. Patients should follow the directions on the label if it requires refrigeration. ConsumerLab.com has tested many of the nationally available probiotic products. One thing they noted on their last review of these products was, of course, lots of the products are labeled with the amount of viable cells at the time of manufacture and may not contain this at the time of consumption. This next slide lists some of the products that were tested by ConsumerLab.com. Align, Culturelle, Florastore, Philips Colon Health, Digestive Advantage. I list these here so you've got a starting point of the major products you're going to have on the shelves when trying to recommend these to patients. You can see what the labeled dose is and what organisms are contained in them. It's very important to note, though, that many of these brands have multiple products in their product line, and the content can be different and the dosing is different. So at least it gives you a big starting point for having a list of what's available. On ConsumerLab.com testing, all of these were found to be 100% of the labeled amount of bacteria or yeast. Many of these products, because of the medium on which the bacteria are grown or the yeast, they may contain allergens. And the allergens, of course, have to be labeled. So milk or soy in some of these products you see here. But I've starred the ones that say they have no allergens. ConsumerLab.com points out that the bacteria in them are still grown on a milk-based medium. So there is still a possibility of trace amounts of allergens. So what do you tell patients? Well, if they're truly allergic to milk, they need to be careful that the products may still have some allergen contamination. So they should go with the ones that have soy allergens if they have a milk allergy. If they have a soy allergy, they can use most of the other products. Only a couple are listed as having soy allergen contamination. One thing about Saccharomyces that I haven't mentioned before is, remember, it's not normal flora. It does not multiply in the gut, apparently. So you have to keep giving it. But we're going to talk more about the fact you have to keep giving most of these if you want to maintain the benefit. But it is one that does not multiply in the gut. This next slide lists some products that are relatively new and have not been tested by ConsumerLab.com. Pro Nutrients Probiotic, TrueBiotics, and the Refresh Pro B. The TrueBiotics product has a special True Preserve canister that's supposedly designed to safeguard the live and active probiotics until the product's expiration date. When stored as directed, of course, is how they tell you. But it protects it from light, heat, moisture, and air. The product hadn't been tested yet, so I can't tell you if it really does help preserve the probiotics or not. A last probiotic product to talk about is VSL number 3. This supplement is a little different than the others in that it is marketed as a medical food, so it has undergone FDA review for that purpose. There are two different VSL number 3 products, regular VSL number 3 and VSL number 3 DS, or double strength. Double strength is a prescription medical food. These products are indicated for dietary management of medically diagnosed ulcerative colitis, ileal pouchitis, or irritable bowel syndrome. And you can see the bacteria that they contain. They do contain trace amounts of milk protein as an allergen. The table on this next slide gives you the dosing for the regular VSL number 3 and the VSL number 3 DS for adults. You can get the kids dosing guidelines from the product website. This product has been studied and has an FDA approved claim as a medical food for these indications. There are a few tips for patients, and some of these we have already talked about. Some research suggests it may be more effective to take a probiotic supplement that contains a mixture of bacterial strains rather than a single bacterial species. Conversely, it is possible that some combinations of strains may not work well together, affecting the ability of the organisms to remain viable. Many of the products on the market contain untested combinations. So again, I mentioned this before, but patients kind of have to experiment to find the right probiotics for them at the right dose. They do need to look for products that have labeled amount expected to be present through an expiration or best buy date. It is hard to find those. Most products only list the amount at manufacture. For yogurts or other dairy products, they need to look for the phrases contains live cultures or has active cultures. Importantly, they do need to follow directions for storage and preparation. Probiotic supplements should be kept out of light, away from heat. Many of the supplement products have very specific preparation directions. If they're a powder that's dissolved in a liquid, most of the time you're not going to want to use a hot liquid, an alcohol-based liquid, or even some of them don't even want you to use a carbonated liquid in preparing them. So follow the directions. They need to watch out for allergens. There can be milk proteins, soy proteins, and even sometimes fish proteins. These will be listed, except for the case where they say there's no allergens, but there is, according to consumerlab.com, that potential for some trace milk proteins in most probiotic supplements where the bacteria has been grown on a milk-based medium. This next slide shows you a graph from a study where they gave patients probiotics for 10 days and measured the amount of bacteria that appear in the feces. That's how we prove that probiotics survive. And then they measured the amount in feces after the patient stopped the probiotics. As you can see, in general, probiotics disappear from the feces when you stop taking them. So they only work as long as someone is taking them. Probiotics do seem to lead to a transient colonization. Now, whether this colonization of the intestines always necessary for probiotics to exert their beneficial effects is not certain. Because it takes time for an individual's GI microflora to adjust, it may take several days or weeks of consistent use for the patient to feel any effect from regular probiotic use. I recommend people give stuff at least 2 weeks, maybe 4 weeks, to see if they're going to get an effect. And if they're not getting sufficient effect, that's where they may need to switch to another product. The recommended intake for probiotic supplement varies by strain and indication, but tends to be about 1 billion to 10 billion colony-forming units per day. You can see these may be written differently on the label, a little hard for patients to pick up what exactly it's telling them. Doses of specific probiotics required for specific clinical effects are not well established. So again, patients are going to have to experiment. Saccharomyces is the only one where it's a fairly well-established dosing, starting with 500 milligrams QD and going up to 4 times a day. Start people once a day with the Saccharomyces products and increase if they're not getting enough effect. There are a couple safety issues to talk about. In general, probiotics are considered GRAS, generally recognized as safe. Some people can get diarrhea or gas when they start taking a probiotic. You may have to adjust their dose down somewhat. I have taken people who had chronic functional constipation and given them diarrhea, so I had to back off on the dose. Sometimes people only need the probiotic a couple days a week even. There is an issue if people have a yeast allergy that I haven't mentioned. There are also those rare reports of bacteremia, fungemia, and endocarditis in people being treated with probiotics. Most commonly occurs in people who are severely ill, immunocompromised, enterally fed, or have a central venous line. They got a puncture somewhere that allows the bacteria or the fungus to enter their body. It's also been reported in people with short gut syndrome, also known as short bowel syndrome. These people have impaired gut integrity, and it's thought that the bacteria can cross over through this disrupted mucosa and infect the blood. If patients have one of these inflammatory conditions like inflammatory bowel disease that they're looking to use a probiotic, it may be best to wait to start it until their inflammation is under better control. You probably don't want to start these when someone is in a full-blown attack of Crohn's disease. Maybe best to wait till it's calmed down some to start the probiotic, because you don't want to be giving these live bacteria when they have these very severely disrupted intestinal mucosa, and the bacteria can cross over and cause a bacteremia. It is recommended to separate antibiotics from bacteria-based probiotics by 2 hours and not to give Saccharomyces with antifungals. Let's put it all together now with the case study. Mr. Jones is a 49-year-old who requests your help. He's had diarrhea for several years, basically as long as he can remember, 4 to 5 very loose bowel movements per day, some cramping but no bloating or excess gas. He's never had bloody diarrhea, and he's never been diagnosed with any particular gastrointestinal problem. He's eliminated lactose, fatty foods, and carbonated sodas from his diet. This improved his symptoms, but he still has 2 to 3 loose bowel movements per day. So what are our options for him? He could do increased fiber in his diet. That's one way to help with diarrhea if people don't have a lot of fiber. You'd have to look for other reasons. Are there other reasons he may be having diarrhea? One that he hasn't tried is avoiding fructose. Some people who think they are lactose intolerant are actually fructose intolerant. But lactose intolerance and fructose intolerance tend to go hand in hand. The other thing, of course, is gluten. People who have a true gluten allergy, celiac disease, if that's suspected, they need to be tested. Now, there are many people who have gluten intolerance. It's not a real allergy that they have to absolutely avoid gluten, but that they feel better when they avoid gluten. So that's something to look at. He might consider eliminating, but it is very, very difficult to eliminate all sources of gluten from one's diet. What if we do all those things and he's still having issues? It sounds like this guy probably has irritable bowel syndrome. He doesn't have inflammation, so he doesn't have inflammatory bowel disease. So he can probably manage this on his own because he's done many things that have helped. Things he could do would be yogurt, start with 1 or 2 containers a day. It might take some convincing because he is lactose intolerant and he resists dairy products very aggressively. That's an option. The other option would be to go with a probiotic supplement. I would probably go with a bacteria-based here to start. Once the GI symptoms are stabilized in somebody like this who has diarrhea, the patient can back off on dosing to find a good maintenance dose, and it may only be a container of yogurt 3 to 4 days a week, which is actually what has happened with Mr. Jones. He has to do at least twice a week to not have very, very loose bowel movements. But everyday yogurt caused him to develop constipation. Wrapping up, dysbiosis can be due to antibiotics, immunosuppression, dietary changes, and physical stress. Probiotics may exert beneficial health effects on the host by altering flora within the body. The potential mechanism of action of probiotics includes anti-inflammatory effects, preventing pathogenic adhesion, improving immune response, and restoring balance of good bacteria. Evidence-based use of probiotics includes treatment of diarrhea, constipation, irritable bowel syndrome, inflammatory bowel disease, vaginal flora alterations, and lactose intolerance. The effects may be species-specific, and dosing is not well defined, so it does require, as I've said repeatedly, some experimentation. I hope you found the information in this program helpful in your daily practice.